Good afternoon. Shall we start then? Welcome everyone, and thank you for joining our today webinar. Please let me briefly introduce myself. I'm Manuela Balan, the marketing responsible at IceMed, and I will be your host for about 1 hour today, together with our guests from Finland, from the Finnish company LymphaTouch. As you've already learned, we are going to discuss today about a new technology, a new and innovative technology called LymphaTouch, which combines the negative pressure with mechanical vibration. It has applications into rehabilitation, orthopedics, sports medicine, and aesthetic medicine. Our topic for today's discussion will be related to how negative pressure can be integrated into the process of active rehabilitation. So we will treat the first three main areas: rehabilitation, orthopedics, and sports medicine. For this, I'm happy to introduce our special guest and speaker from today, Ms. Mira Väyrynen. Mira is a clinical specialist at LymphaTouch, providing education and coordinating research related to LymphaTouch negative pressure treatments. Mira,
hi everyone.
Is yours.
Thank you. So good afternoon, everyone. I'm very happy to join today, and I will start my video. Very soon. Okay, so now you can all probably see me. So thank you, Manuela, for the introduction. Today I will tell you more about how negative pressure can work as part of active rehabilitation. Greetings from Finland. We are located here. So I hope you can see the presentation now. Just a second. Okay. So here you can see a few pictures already about our technology in use. And here is the device itself. So LymphaTouch is a medical device that creates negative pressure and mechanical vibration to relieve swelling and pain in many different kind of conditions. So usually when we are doing any type of manual treatments, we create positive pressure. With any type of instruments. But with LymphaTouch, we create negative pressure. So that's a different type of approach to the treatment of soft tissue mobilization. It's a Finnish product and our headquarters is here in Finland, but we have distributors in all over the world in more than 30 countries at the moment. So here is a small recap about the lymphatic flow. As you probably learned from the name already, LymphaTouch, the LymphaTouch was previously used by lymph therapists, but nowadays it's been used quite widely in rehabilitation segment. So we work with the lymphatic flow, so it's good to understand the basics about the lymphatic flow. The most important thing is that lymph goes only in one way, so it moves from distal to proximal direction when the blood circulation again moves in both ways. But the interstitial fluid diffuses originally from the blood capillaries. And the lymphatic capillaries in basically everywhere in our body, they absorb this interstitial fluid and move it back towards the blood circulation. All the capillaries, they join and they form lymphatic vessels, which are thicker and bigger, and the lymphatic vessels, they carry the fluid in proximal direction towards the blood circulation. On the way back, the lymphatic fluid always passes through the lymph nodes that we have hundreds around in our body, mainly in armpits, in inguinal area, in stomach area, and all this lymph goes from those lymph nodes that basically clean and filter the fluid. The lymph fluid eventually it goes either to the thoracic duct or the right lymphatic duct, and from those it goes back to the blood circulation on this area over here in subclavian veins. So with LymphaTouch, we basically enhance this lymphatic flow by using negative pressure to activate the ducts from this area over here, to activate the lymph nodes and the lymphatic capillaries, and then guide the lymph proximally toward the healthy lymphatics. This is good to understand, especially when we are working with the swelling in case of post-surgery treatments, or in acute swelling such as ankle sprains or acute traumas or injuries. But then again, we can also mobilize soft tissue with the negative pressure. I will show you in a minute. So here is a video that explains pretty nicely how the LymphaTouch works. So when we apply treatment head to the skin, it automatically starts to expand the tissue. And that's how we activate the capillary network, by moving the anchor filaments. And that's how we open the endothelial holes, and the extra fluid around those lymphatic vessels can move back to the lymphatic system. This is how we activate the pumping mechanism of the lymphatics, and we can really enhance the lymphatic flow and reduce swelling and we always guide the lymph from distal to proximal parts, because that's where the lymph basically flows. So this is the operating principle, especially when treating swelling, as I already mentioned. And then here is also a nice ultrasound video that shows how we can also facilitate and mobilize soft tissue underneath the skin. Here you can see the movement. So we are doing pulsation with the device. So it has the work phase and the rest phase. As you can see, it's a dynamic movement that we create with our device. So we can facilitate and mobilize the fascial structures in both superficial layers and even deeper layers. And you can also see the movement, how we activate the lymph nodes here in the middle. We have more of these ultrasound videos available online, so you can go and see them if you are more interested to see more videos. So application areas are quite many, as I mentioned already before. So rehabilitation is a wide segment, and I think that most of you are also working with the rehabilitation segment. So it covers basically soft tissue mobilization for cancer rehabilitation or musculoskeletal disorders, any type of soft tissue mobilization that we can do with the negative pressure. It's especially good for tight fascial structures or tight scars, fibrosis, and acute and chronic pain as well, to make the fascias move more. It's especially good for edema management, as we mentioned already. So for lymphedema following the cancer treatments, for example, it's very good tool for that. In orthopedics, it's clearly good for pre and post-operative swelling. So when we can reduce swelling after the operation, the patients can start to do the exercises and the gait training, for example, sooner and without pain that much. Because when we reduce swelling, we can also move our joints more fluently, and it also helps with pain quite a lot. In sports, there are many different applications for LymphaTouch. So basically, it's very good part of recovery treatments to reduce, for example, DOMS, and for contusion traumas, sprains and strains, shin splint, ankle sprain. It's very good, again, to reduce swelling, and it also helps to get the athletes back to the field faster than without applying negative pressure treatment. In aesthetic medicine, the treatment applications are more or less the same as in orthopedics. So basically, after plastic surgery, reconstructions, surgery, bruising, scars, skin stiffness again. So there is a wide segments or wide selection of segments that you can apply LymphaTouch as part of the therapy. So basically, it's a supplementary tool. It's not a miracle, but it's a very great tool for the professional to get better outcomes in the therapy. So why would anyone use LymphaTouch? That's a great question. So what we can create with LymphaTouch is an additional direction to the manual treatment. So we can apply negative pressure in a controlled way. Many people like to compare LymphaTouch for cupping, for example. It's a very traditional way to do the negative pressure treatment, but you can also create or damage skin and tissue with the cupping. So with LymphaTouch, we don't want to damage. We can adjust the negative pressure very precisely and also apply it in a dynamic way. Of course, also with the continuous mode, but the dynamics makes it more safe and more precise, and it's also very efficient in many different things that you can use it for. It improves the therapy outcomes. I will show you some results of the studies in a minute, so I will come to this later. And it also helps with faster recovery, especially after heavy resistance training or sports, and also if there is a surgery, so the people can start with the gait trainings or exercises faster, because the swelling is reduced and also the pain is less. One thing is also that it saves the hands of the professional. The manual treatments are very hard work. So as a physical therapist, I've been working as a physical therapist for a long time. So our hands are sometimes sore and painful. So it's also good to have different kind of tools for manual interventions. It's also when you can provide something different for your customers, it can also bring you more customers. This is what we have learned from many customers that are using LymphaTouch, is that they can actually get more customers when they have something different and something very, very innovative in their clinic. So as a recap, you can use LymphaTouch for edema management, for pain management, and soft tissue mobilization with negative pressure instead of positive. And there are many different customer groups and patients that you can utilize our technology as part of active rehabilitation. Okay, then I will tell you more about the product itself. So now you have learned what you can use LymphaTouch for, but what kind of outcomes or the benefits can you actually see? Here is the device sales set that basically you can have a trial, and Manuela will tell you more about that opportunity later. But here you can see what you get when you see LymphaTouch. So it comes with the main unit that you can see here. LymphaTouch is very small in size, so it's only 1 kilogram, and you can always take it with you. You can also place it in a roll stand that you can see here on the right side. But you can always go take it with you if you are doing any type of home visits or working in the sports field, for example. It always comes with different sizes of treatment cups, so we can always choose the treatment cup to fit the body part that we are treating. Here you can see the biggest one, it's 80 millimeter cup, it's about this size, and then the smallest treatment cup is only 10 millimeters, so it's very beneficial for local scar treatments or fingers and toes and around the face area. It also always comes with the carrying bag and the charger. The 10 millimeter treatment cup that I mentioned is an extra accessory at the moment, and there is also possibility to upgrade the software to the sport upgrade. And also the roll stand over here is an extra accessory. So I mentioned about the sport. We have the standard LymphaTouch that always has the opportunity to adjust the negative pressure value between 20 and 250 millimeters of mercury. But with sport upgrade, you can have more power to the units. So the maximum negative pressure value is 350 millimeters of mercury. It's something that the sports athletes were wishing to have more intense treatments for soft tissue mobilization and treatment of strong and thick fascias and muscles and tendons. So sport upgrade is an additional feature of the standard LymphaTouch. Okay, then about the treatment techniques, and I have a video that I will show you in very soon. So here you can see the symbols of the treatment, different kind of treatment techniques. We have stationary, lift and twist technique, sliding technique, and kneading technique. This we have the educational videos that show all the treatment techniques available online, and here you can see the link for that. But I have added them also in this presentation. So first is the stationary technique that you can see there on the left up corner. And we are staying in one spot for 3 to 5 pulsations, and then we will move to the next spot. It basically is the first technique that we always start with to see how the tissue reacts, how the patient feels, and we can adjust the negative pressure according to those feelings. So you can, as you can see there, you can also apply some traction to the joint if you want to improve range of motion. So there are different kind of techniques that you can apply there in the treatments. The next treatment technique is lift and twist technique. And here they are using the continuous negative pressure at the same time. So lift and twist technique is used mainly when we want to more intensively mobilize the soft tissue. It's a good fascial technique. It's good technique for scar tissue management. And whenever we want to soften up the tissue more, fibrosis, for example. Sliding technique is very common technique, and sliding technique is used mainly when we want to guide the lymph back towards the proximal parts. So when we want to reduce swelling, we do the sliding technique. Here they are first using the pulsation mode, so you can see that there is the work phase and the rest phase of the negative pressure. But then they also are applying it with the continuous mode. So you can have the negative pressure inside of the cup all the time. Now you can see that one, or now they are changing it. It's much more intense when you are using the continuous mode. It's very, very efficient for myofascial treatments, for example. And last but not the least, we have the smallest treatment cup in use. The patient has a scar in her neck area, and it's the kneading technique is a combination of the sliding technique and lift and twist technique, and it's very efficient when we want to reduce or soften up the scar tissue, or if we want to break up adhesions in scars. And it's also very good for fibrosis if we are using a little bit bigger treatment cup. So there are different types of techniques that you can apply when using LymphaTouch. Then I have few case examples to show you what kind of results you could wait to see with your patients when using negative pressure. By the way, if you have any questions, you can write them in the meeting chat, and in the end, we will have more time for questions and answers. I'm sorry, I forgot to mention this in the beginning. So case example, case number 1 is an ankle sprain. Here on the left-hand side picture, you can see the situation before, and on the right-hand side, you can see it after. So you can really see a lot of improvement in the stage of swelling after the ankle sprain. Here, the treatment was 45 minutes, which is a rather long time. And that's the reason, because it's in the distal part of our body. So it takes more time when we activate the capillaries of the lymphatics and then guide the lymph back towards the proximal parts. After this treatment, they applied also kinesiotaping, and the patient was able to do the gait training without pain. So it was very beneficial for him. Here is a treatment example of the ankle sprain, because many times when I show these pictures, people are like, okay, well, nice results, but how did they get this? So there is an example. So we start the treatment by activating the main lymphatics from the ducts, and then we activate the lymphatic nodes from the inguinal area. And then we move from proximal to distal and then back to proximal. Here you can see the different treatment techniques that we do. So we always activate first with the stationary technique and then slide back towards the proximal parts. Then we move more distally again and treat around the ankle itself and also there, and eventually are doing a lot of sliding to move the lymph and to activate the lymphatics. And in the end, we can also have the activation of the main lymphatics over here. We have more protocols available in treatment instructions for rehabilitation applications, and this booklet always comes with the device. So it basically gives you an idea on what kind of treatments you can do, what kind of settings to choose, how much negative pressure to start with, and so on. Here is another case example. This is done by Kevin Wilk, who is an champion sports medicine in the United States, and he's working a lot with sports athletes. And here is a baseball player who had an elbow surgery. And here you can see the situation before and after the treatment. And this was only a 10-minute treatment with LymphaTouch, and they could start with the range of motion exercises more efficiently when they could actually reduce the swelling quite a bit. Many times you can also apply compression afterwards to maintain the results. Here is a case example of an athlete after a boxing match where he has a lot of swelling and bruising around in his face, basically. And here they combined LymphaTouch treatment with cryotherapy and also LED therapy. And the picture on the left side is before the treatment, and on the right side is 24 hours after the treatment. This is a good, an excellent example when you combine different kind of treatments. So it's also that you always need to evaluate individually which would be the best solution for your patient to apply different kind of manual techniques or interventions, and what type of exercises you want to conduct with your customer. And this case example is after knee operation. So it is, I think this was the second post-operative day. So 30-minute treatment with LymphaTouch before and immediately after the treatment. So you can really work with the bruising as well, because the color of the skin is completely different after the treatment, and also the swelling state is lower. And then this patient was also able to do the exercising better when he didn't have that much compression in around his joints. Yeah, again, a reminder about the rehabilitation applications, because many times people, when they have the unit first time in their hands, they want to have some type of protocols and ideas on how to do different kind of treatments. So we have these treatment instructions that always come with the unit, and also a lot of educational material available on our website. Okay, about the study results. So there's a lot of ongoing studies, but also already conducted studies with LymphaTouch around the world. In here, I have collected mainly the study results from the field of general rehabilitation and M.H.Sc and sports. So first of all, there was an interesting study made by Greenstein and his group in the United States, where they had an acute low back pain patients. And they did a LymphaTouch group which received LymphaTouch treatment, and the sham group who received a sham treatment. And in the study, the group that received LymphaTouch real treatment, they improved in pain and range of motion in low back pain after acute low back pain. When the sham treatment group, they didn't improve these outcomes. Also, this is actually a rather large study. This is a pilot study with this many patients. This was conducted in Göttingen in Germany. So there were a lot of orthopedic patients, more than 100, and they were treating them immediately post-operatively. And what they saw in this study, that the LymphaTouch treatment decreased swelling, that it enabled trauma and orthopedic patients to be operated earlier and also to be discharged from the hospital earlier. So it really efficiently reduces swelling after and before the treatment or the surgery. Then there is one study where they had carpal tunnel syndrome patients, and they saw that LymphaTouch treatment reduced the pain and also improved hand function for those patients. Then this study, they were combining LymphaTouch treatment with different kind of exercises and active physiotherapy. And their already 20-minute use of LymphaTouch was very efficient and reduced pain even by 50%, which is very significant result. And in another study, they saw that LymphaTouch treatment could even stop pain medication, which is a great result. This study was conducted with the systemic sclerosis patients, which is also very, very interesting. And they saw that LymphaTouch treatment really improved the upper extremity function and the physical function of those systemic sclerosis patients. And there's one more study in the neurologic field. So patients who had stroke, this was also a controlled trial. So they had a control group, and they saw a positive effect on muscle tone, stiffness, and balance ability with stroke patients. So the contraindications, I want to mention this in this point. So the contraindication for LymphaTouch treatment are exactly the same as for any other type of manual treatments. So it's very safe for many patient populations, as you can see from this slide. It has been used in many different populations, and it can be used even like from the first post-operative day. But of course, with LymphaTouch, we don't go on top of open wounds or open scars, but we can treat around that area to activate the lymphatic flow, to activate the metabolism around and reduce swelling. but do not go on top of the fresh scars or open wounds. There is more studies available again, and all the evidence is basically in one document. And this clinical proof book is available on our website. So there are all the study abstracts of the studies that have been conducted with LymphaTouch if you are more interested to see how these studies have been done. And there is much more with lymphedema patients and for sports patients and many other populations. In this proof book, there are also some professional testimonials and patients telling about their stories on how LymphaTouch actually improved their conditions. Okay, so this was basically my part, and then Manuela, maybe you can join now and tell more about the webinar offer that we have for the attendees, and then we can have some time for questions and answers.
Thank you, Mira. Thank you very much for this wonderful presentation. Yes, actually, as you said, as you mentioned, we have a special offer for all the participants to this webinar. We will provide with a free trial possibility for 1 or 2 weeks. It depends on the needs of every interested person, and this will be possible by asking us after the webinar, and we will schedule a free trial for every party interested in this. Besides this, we can offer for any purchase by the end of this year. We can offer a special package with a sports module added for free. So if you have cases in sports medicine, this might suit you and help you with your work. So I think
then there's time.
Yeah, right.
Yeah, I will now stop my presentation. So if there are any questions now, there is good time for the answers, and me and Manuela, we can both answer to your questions.
So you can type your questions, and Mira and myself, if you also have questions for me, we'll happily answer you.
Yes. So LymphaTouch, I think I didn't mention this already, but it was already launched for the first time in 2009. So it has been there available for 10 years, more than 10 years already. And if you have heard of PhysioTouch before, it's exactly the same device. So we started as LymphaTouch, and then it was PhysioTouch, but now we are again LymphaTouch because the name LymphaTouch tells more about the product itself. But we have been there on the market for a while, but in Romania, I think from this year, we started the collaboration with Romania. Do I remember correct, Manuela?
Yes, this is right. We are happy to be the distributor for Romania since the beginning of this year, and yeah, we hope to do a good job here because this is a great technology. Also, already tested in Romania. We had it in trials for some hikers that reached Mont Blanc Peak this summer, and they used this great technology, LymphaTouch, for their training in order to reach their goals. So yeah, we hope to.
So now we received the first question. Which is the recommended number of therapies per week? That's a great question, and it's also a very common one. However, there is no like one answer that fits for all. So basically, it really depends on the indication. In case of acute injuries or acute swelling, post-operatively, acutely, it's good to apply the negative pressure treatment even every day for, I would say, 1 week, or how long you see the swelling around that side. So you can really apply it every day or even in three times per week. But again, in chronic conditions, you can apply LymphaTouch once per week for 8 weeks, or it really depends on the condition. For scar management, LymphaTouch is many times applied once or twice per week, and you can really see the difference after, I would say, 3 treatments. Sometimes you can see it immediately, as I showed to you in those pictures. But it depends on the indication for use and also how the patient how the condition shows. So it depends on that. Another question is that what pressure level do you recommend for one rehab session or treatment? That's a great question as well. Usually during one treatment session, we use different pressure levels. So we always start low in the beginning. And when I say low, I mean 50 to 80 millimeters of mercury of negative pressure. Remember that negative pressure is completely different than positive pressure. So even 80 millimeter of mercury might sound very much, but it's not actually that much because we are working very, very locally with our device. So the first treatment session, I would say that we would work between 50 to 150 millimeters of mercury on that scale. And for tight fascias, tight muscles, scar tissue, we can use even 250 millimeters of mercury negative pressure levels. So it really depends again on the condition that we are treating, and also the indication and how the patient tolerates. So we start low and increase gradually, but we can use different pressure levels during one session. And when we treat lymphedema or post-operative swelling or any type of swelling, then we don't need that much negative pressure. So when working with the lymphatics, as we all know, the lymphatics are in very superficial layers of our tissue. So all we need is some movement, and we don't need that much. But when we want to really mobilize the tissue, we need more negative pressure. I hope I answered to the question.
Yeah, that's great, Mira. Thanks.
Then we have another question. The effect of the therapy is immediate, or does it request a certain time to see the results? Sometimes you can really see it immediately, as I showed you from the pictures. So in these pictures that I showed you, there was only one session. So you can immediately see how we can reduce swelling. But again, in some conditions, it takes more. But the basic rule that we always say is that 3 treatments, and then you would see some difference in some outcome. If 3 treatments don't work, then the negative pressure treatment is not probably the best solution for the indication, but usually you see it immediately or 1 day after the treatment. It's also good that the patient would drink some water after the treatment, because many times when we increase the metabolism quite a lot with our treatment, the people also feel very thirsty, and we really want to avoid any type of dehydration. So it's good to drink some water after the treatment, just like after any other type of massage or any other manual treatments. Thank you, Nicola, for your great questions. Very good ones. Any other questions coming up?
Yeah, I think someone is typing a question.
Yeah,
No?
great.
Okay.
Now I got one. What is the effect of the mechanical vibration? Oh yeah, that's a great question. I didn't mention that much about this mechanical vibration. So the negative pressure is the main thing that the device creates, and the mechanical vibration is a nice add for that. The mechanical vibration is especially good when we are treating fibrosis or scar tissue. So basically, when we want to break up adhesions and work with deeper tissue levels. There's actually one great ultrasound video that you can see in our website where you can see the movement that the mechanical vibration causes. So it's good also when we want to relax. If there is hypertension in the tissue, the mechanical vibration is pretty good for those. So softening up the tissue, then the mechanical vibration is very efficient for, and also for deep swelling, it's rather good. Good question. And also, I think I didn't mention, so you can adjust the negative pressure between 20 and 350 millimeter per mercury, but then again, mechanical vibration can be adjusted between 20 and 90 hertz. And when we use 90 hertz, it's for very superficial layers of the tissue. And when we use lower frequencies, we can go deeper in the tissue. That's one thing. Yeah, you asked how we can adjust the frequency. Yeah, I think I mentioned, I didn't see that question, but I was talking about it. So it's very simple to use the device and the software. So you can adjust higher frequencies for superficial layers and deeper frequencies, lower frequencies for deeper layers of the tissue. Usually we start first with the 90 hertz and then we can apply lower frequencies and go deeper in the tissue according to the patient. Thank you for your questions. Any other questions?
Yes, please take advantage of Mira now, as long as we have her here, and please ask your questions.
Yes, and Manuela and her great IceMed team is also very aware of LymphaTouch, and they know a lot about the technology. And we are also happy to support IceMed and also your customers and all the therapists. So if you have questions, you can always contact either IceMed or Manuela and her team or us here. We are happy to help you with your questions or thoughts.
Yeah, it's the same. We're always open and happy to answer all your questions, and also for the demo, don't hesitate to ask us for a trial after this this webinar.
I really encourage all of you to try the device because it's free. It's free of charge. You can see the results immediately with your patients and see if it could fit to your practice. So it's a great opportunity to really try out the device by yourself and see the results if it's beneficial and good fit to your own practice. It's a great opportunity. Any other questions?
Mm-hmm. Well then.
Yeah, I think I gave so much information already, but many times when you get the device in your own hands, you have more questions. So then it's time for questions again. But thank you so much for your time today, and thank you, Manuela, for co-hosting this webinar together with us. I think it's great to do collaboration with you, and yeah, I encourage you all to try out the device. And if you have questions, Manuela and her team is more than happy to answer.
Thank you very much. Thank you very much, Mira. Thank you to the whole team of LymphaTouch. We are honored to be partners here for Romania. And thank you everybody for attending this webinar. I hope it was helpful for you. And don't forget to stay in touch, to ask for a trial, because we have the device here and we can provide it free of charge to any of you to try it to your clinic or hospital on your patients, and to give your feedbacks and whatever you consider proper to do with this amazing technology, I would dare to say, because we have tried it, and yeah, we were more than convinced that the results are fantastic. I would also like to add that we will provide you actually the clinical book proof with a lot of wonderful examples that Mira mentioned before, to see how to understand better how this technology worked for others as well. So thank you again for attending.
Thank you, and have
today.
a great day.
Thank you, Mira.
Thank you.
Regards.
Bye.
Bye.